Hi, now my name is Mohammed Ali Haider, and today I will be delivering lecture on pharmacology. This will be lecture number 5. Um, Terostatic bonding. Terostatic bonding is much more common than the covalent bonding in drug receptors interactions. Electrostatic bond vary from relatively strong changes between permanently charged ion molecules to a weaker hydrogen bonds and a very weak uh, placid dipole interactions such as van der Waals forces and similar phenomena. Heterostatic bonds are weaker than covalent bonds. Hydrophobic bonds are quite weak and probably important in interaction of highly with the lipids of cell membrane and perhaps interaction in drugs with the internal wall of receptors pockets. The specific nature of particular drug-receptor bond is of less practical importance than the fact that the drugs that bind through weak bonds to the receptors are generally more selective than drugs that bind by means of very strong bonds. This is because of a weak bonds requires a very precise fit of the drug to receptors. If an interaction is to occur, only a few receptor types are likely to provide such a precise fit to a particular drug structure. Thus, if we wished to design a highly selective short-acting drug for a particular receptor, we would avoid highly reactive molecules that form covalent bonds and instead choose a molecule that form weaker bonds. A few substances that are more almost completely insert in the chemical sense nevertheless have significant pharmacological effect. For example, xenon, an inert gas, has anesthetic effects at elevated pressures. Drug shape. The shape of a drug molecule must be such as to permit binding to its receptor site, while the bond has just described optimally, the drug shape is complementary to that of receptor site the same way that a key is complementary to a lock. Furthermore, the phenomena of a chirality stereoisomerism is so common in biology that more than half of all useful drugs are chiral molecules. That is, they can exist as dynamometric pairs, drugs that with two asymptomatic centers have four diastereomers, e.g., ephedrine is symptomatic drug. In most cases, one of the most dynamometed in such more potent than its mirror image dynamometers, reflecting a better fit to its receptor molecule. If one imagines two receptor sites to be like glove into which a drug molecule must fit to bring about it to its effects, is clearly a way a left-oriented drug is more effective than in binding to a left-hand receptor than its right-oriented dynamometer. Dynamers: the more active dynamometers at one type of receptor site may not be more active at another receptor type. For example, carvedil, a drug that interacts with adrenoceptors, has a single chiral content center and thus two dynamometers. One of these dynamers, the S isomer, is potent B receptor blocker. The R isomer is 100-fold weaker than the beta receptors. However, the isomers are approximately equipotent as alpha receptor blockers. Ketamine is an intravenous static. Etanerase is more potent anesthetic and is less toxic than the dynamers. Unfortunately, the drug is still used as racemic mixture. Thank you very much. Till next time. Take care.